It is a great honor that I rise before this Honourable House to present the National Development Plan, NDP 12 chapter for the health sector. This chapter represents a critical component of our national vision for sustainable and inclusive development, as it outlines the strategic direction and policy priorities that will guide the transformation of our health system over the NDP 12 period. The chapter provides a comprehensive overview of the current state of the health sector, detailing performance as well as existing and emerging challenges that continue to shape our national health landscape. It further examines megatrends influencing the sector, identifies key opportunities for innovation, partnership, and investment, while also highlighting potential threats that may hinder progress if not addressed proactively. It further articulates the strategic priorities and policy interventions designed to strengthen our health system, improve access to quality and equitable healthcare services, and enhance the overall well-being of our people. These strategies are underpinned by a compact performance framework, which sets out measurable targets, indicators, and outcomes to ensure effective monitoring, accountability, and alignment with national and international development and commitments. Madam Speaker, the presentation of this chapter is not merely a procedural matter. It is an affirmation of our collective commitment to building a healthier nation, one where every citizen has an opportunity to live a long, productive, and dignified life. Madam Speaker, on healthcare sector performance and current status. The NDP 12 chapter on healthcare is designed to align with the Botswana Economic Transformation Plan, BTAP, aiming to steer and transform both our nation's economic and healthcare system for a better future. The true north of the health sector is defined as that of expanding universal health coverage, the index by at least 75 by 2030, diversifying financing beyond government budgets, and building a system that is more resilient, inclusive, and sustainable. The true north will focus on two pillars, being, number one, increased universal health coverage index, which we seek to raise from 55 to 75 by the year 2030. Diversified healthcare financing, with the intent to reduce the share of government health spending in total health expenditure by approximately 80% from 2024 to down 60% in 2030, reflecting a gradual shift towards private and alternative financing sources. Botswana has over the years excelled in providing universal health access, but needs to improve health outcomes by revitalizing primary health care, optimizing specialized health services and referral pathways, ensuring reliable, adequate medical equipment, modernizing infrastructure, improving supply chain efficiency, and digitalization services. Furthermore, Botswana primary healthcare framework is anchored in an extensive network of healthcare facilities operating through a decentralized approach that ensures accessibility and responsiveness at all levels. A revitalized primary healthcare system represents a transformative shift from predominantly disease and institution-focused services towards a more people-centered approach or model that empowers communities and promotes active community participation in their own health and well-being. Primary healthcare remains the foundation of our national healthcare service delivery, driving equitable access and sustainability through a comprehensive approach that encompasses one, honorable furniture, health promotion, advancing wellness and encouraging healthy lifestyle across all communities, two, disease prevention, including mental health disease prevention and early intervention initiatives. 3, treatment of diseases by providing quality integrated care for both physical and mental health conditions. 4, rehabilitation by addressing both physical and mental recovery needs, including drug rehabilitation services. And 5, palliative care, ensuring the prevention and relief of associated suffering with life-threatening illnesses while preserving dignity and quality of life. This renewed focus reaffirms Botswana's commitment to a holistic, inclusive, and community-driven primary health care system that serves as the cornerstone of sustainable health care for all. Madam Speaker, allow me to highlight key development and challenges in our healthcare sector. I will start with healthcare service delivery. The healthcare sector continues to face significant challenges. The maternal mortality rate has increased from 130 in 2020 to 155 in 2023 per 1,000 live births, moving away from the national target of 70. The under 5 mortality rate declined from 48 to 28.4 per 1,000 live births. And while this is commendable, this performance remains above the upper middle income benchmark of only 14. Communicable and non-communicable diseases account for 32.8% of the 20 leading causes of death in Botswana. Persistent shortages and uneven distribution of specialists and community health workers continue to weaken screening and increase referrals to hospitals. Health infrastructure remains a concern, with the maintenance budget averaging below 2% of the World Health Organization recommended target of 4 to 6%. A majority of facilities do not align with Botswana's essential health service package, and the associated inadequate infrastructure, including roads and transport, communication, continue to cause delays to access of care. Madam Speaker, on health financing remains constrained with a limited fiscal space as government contributes about 80% of the total health expenditure, leaving the health sector vulnerable to economic shocks. Botswana's hospital-centric funded model, with about 70% of recurrent spending directed to hospital curative services, limits investment in preventive and primary health care. In addition, health insurance coverage is low and fragmented, reaching only 17% of the population in the formal sector and only 5% in the informal sector. Madam Speaker, on medical commodities and supply chain logistics, you may want to pay attention, honourable members. Botswana continues to experience acute shortages of essential medicines and necessary medicines, particularly painkillers, antihypertensives, and other non-communicable disease treatments, with the ability of drugs being at 63% in 2025 and now a decline to about 52% availability. And this availability, honourable members, is expected to significantly improve with procurement of medicines and consumables that were procured during the period of the state of emergency. On health information services, lack of real-time healthcare data hampers service delivery within this sector. The health information system and monitoring evaluation frameworks face significant challenges, including underreporting, weak data integration, and incomplete sector reporting. The Integrated Patient Management System, IPMS, operates in only 54% of public facilities, while data systems remain fragmented and poorly connected. This low utilization of electronic systems at facility and district levels further limits effective monitoring, planning, and timely health surveillance. Strategies now for NDP 12. Botswana has made commendable progress in expanding access to health services, demonstrating high levels of effectiveness in service provision. However, there remains a pressing need to enhance the quality of care to achieve better health outcomes for our people. I'll now talk about the national health insurance and this reform. Currently, our health financing model is heavily reliant on government, which covered, as I stated earlier, Madam Speaker, about 80% of the total health expenditure, and this expenditure is largely through taxes. The fragmented insurance market leaves the majority of our citizens without protection. To address this, the government will develop, pilot, and implement the National Health Insurance Scheme that is financially sustainable and socially equitable. This scheme aims to expand universal health coverage to healthcare while ensuring fiscal sustainability and responsible resource management. On national health service modernization, Madam Speaker, despite significant progress, Botswana still faces critical challenges, including, as I stated, maternal health and child mortality rate, a growing disease burden, low primary health care utilization, and excessive referrals. To address these issues, Honourable Lucas, the government will implement cost-effective, prevention-focused reforms through a modernized primary health care framework. Key initiatives will include developing and rolling out the updated PHC framework, finalizing and implementing the Essential Healthcare Service Package, EHSP, and strengthening community health systems to expand access to improve health outcomes. On infrastructure development, Madam Speaker, the focus during the NDP 12 is on developing critical infrastructure and optimizing existing healthcare facilities to support and realize the true north of health. Therefore, the sector will prioritize refurbishment and expanding existing infrastructure, maintenance, and limited construction of new health facilities where necessary to enhance service quality. I wish to repeat that once more, Madam Speaker. The sector will prioritize refurbishment and expansion of existing infrastructure, maintenance and construction of health facilities where necessary to expand service delivery. I thought that was a very important point. Another initiative comprises of upgrading and modernizing of medical equipment. This will be achieved through strengthened equipment management system, incorporating preventative maintenance, life cycle planning, and timely replacement of obsolete technologies, as Honourable Terry has just stated. On health workforce development, Madam Speaker, our healthcare system continues to grapple with shortages of staff, high turnover, and uneven deployment which constrain progress in our service delivery. To overcome these challenges, government will implement a comprehensive human resources for healthcare, HRH strategy, supported by digital transformation. The focus will be to develop and implement the HRH strategy and workload indicator staffing needs, WISN methodology. We will also invest in a skilled, motivated, and adequately staffed workforce. We will recruit specialized health professionals to close the critical gaps. We will strengthen retention, working conditions, and career development pathways to sustain capacity and morale. Madam Speaker, on innovation in health financing mechanisms, Botswana's health financing remains constrained by an over-reliance on tax revenues, a weak cost recovery mechanism, and limited revenue mobilization. This undermines the ability to ensure predictable and sustainable long-term financing for the health sector. Addressing these challenges requires a comprehensive financing and efficient model, as well as a reform agenda. The key initiatives will include, on cost recovery, government will enhance the health sector financing and sustainability through reforms in tariffs, insurance, and cost recovery mechanisms. The essential health service package will also be properly costed, and medical fees will be regularly reviewed to maintain the cost of efficiency. An ancillary revenue from public facilities. Government will explore ancillary revenue opportunities within public health facilities to strengthen financial sustainability. This will include leasing unused facility space, sharing or renting underutilized medical equipment, and introducing commercial services to generate additional income. On transformation of central medical stores, Honourable Botswana. Madam Speaker, the central medical stores transformation is essential to address persistent challenges such as frequent stockouts, limited autonomy, weak capacity, and inadequate visibility of medical inventories. To address the challenges above, bold reforms in government, governance, procurement, and digital systems are being prioritized. The key initiatives include establishing autonomous management structures to strengthen institutional efficiency, reforming current procurement laws to enhance flexibility and affordability, and introducing legislation to enable the timely disposal of expired health products. Digitalization of health services. Madam Speaker, Botswana's health information system continues to face challenging issues stemming from fragmented data, inconsistent reporting, and varied electronic medical record systems, as well as limited remote access. These gaps hinder effective resource allocation and health information systems. To address this, government aims to integrate public and private digital health platforms into a unified system by year 2028, enabling seamless information sharing for healthcare delivery, record management, and regulatory oversight. Key initiatives include the rollout of the EMR systems in clinics and the development of hospital-level EMRs, the creation of eHealth Enterprise as the national digital health framework, and upgrading the national data warehouse to improve data integration and utilization. Now moving on to regulatory enablers. The health sector will embark on a transformative regulatory reform agenda aimed at modernizing oversight, strengthening health security, and enhancing public trust in the health, pharmaceutical, and food industry. These reforms will review outdated laws, close regulatory gaps, and stimulate innovation and industry development while ensuring that the highest standards of public health protection are followed. Some of the strategies or some of the strategic reforms include the following. Botswana's Medicine Regulatory Authority, BOMRA, which seeks to transform BOMRA into an efficient, world-class regulatory authority to safeguard national health security and foster industrial growth. Key objectives include reducing import reliance, integrating traditional medicines into sustainable local manufacturing, promoting export readiness, enhancing investor confidence, and strengthening public trust through adherence to global standards. The establishment of the Directorate on Human Health Research Services will also fill a critical legal and regulatory gap by providing oversight for research involving human participants and investigational medicinal products. This reform positions Botswana as a regional leader in ethical research, attracting international collaboration and investment while supporting national health goals and innovation. Botswana Public Health Institute, BPHI, established to serve as the health sector's premier technical and scientific advisory body, leading efforts to prevent, detect, and respond to public threats, will be strengthened in early system detection, disease surveillance, and emergency response mechanisms while enhancing intersectoral coordination in public health security. The setting up of the Directorate and Health Inspectorate with the mandate of ensuring equitable access to quality health care across all facilities, public, private, faith-based organizations, will promote increased continuous improvement in service quality, safety, effectiveness, and responsiveness. Health-driven fiscal measures, also known as syntaxes, Honourable Mapulanka. Botswana will reformulate existing or introduce new public health taxes targeting harmful products. I repeat, Botswana will reformulate existing and reintroduce new public health taxes targeting harmful products. Revenues will be earmarked for the universal health coverage, prevention and treatment programs. Drawing on international best practices such as the Philippines models, reform will include an annual index increase, dedicated allocations from community health and independent audits, and civil society engagement for accountability. Mandatory medical health insurance for the formal sector worker. The introduction of a mandatory medical health insurance for formal sector employees will expand financial protection and coverage, especially among middle and lower income earners. The reform envisions joint employer-employee contributions, regulatory oversight, and early engagement with the private medical aid providers. This approach will lay the groundwork for a future national health insurance system. These reforms will strengthen the regulatory governance and institutional capacity, enhance health security and emergency preparedness, broaden financial protection and health coverage, improve healthcare quality, safety, accountability, and also increase local and regional competitiveness of health industries. Madam Speaker, on private healthcare. The private and non-state healthcare sectors remain key partners in expanding access to care and driving innovation. Through BTEP, government has engaged the private sector to build a complementary health system where public and private services reinforce each other. Under NDP 12, government is committed to playing a facilitatory role by addressing administrative bottlenecks and regulatory barriers to enable greater private sector participation. While BTEP is not a funding platform, it serves as a catalyst to support and facilitate private sector-led health projects that contribute to national development goals. On monitoring and evaluation, the health sector's true north is to transform Botswana's healthcare system by increasing universal health coverage index by 75 by year 2030. Key trace indicators include diversifying health financing, reducing government contribution from 80% to 60%, reducing maternal mortality, lowering under 5 mortality, decreasing premature NCD mortality from 58 to 48, and achieving zero malaria incidence and increasing TB treatment coverage from 58 to 90. In conclusion, Madam Speaker, the health sector chapter of NDP 12 sets out a clear and forward-looking path towards building a resilient, inclusive, and efficient health system. It recognizes the need to improve the quality of care, strengthen health financing and governance, modernize infrastructure information systems, and invest in skilled and motivated workforce. This will be done through strategic partnerships with the private sector and the implementation of key reforms such as the National Health Insurance, primary healthcare revitalisation, and digital transformation. Botswana aims to ensure that every citizen has equitable access to quality healthcare services. Madam Speaker, the government remains fully committed to transforming the health sector so that it continues to serve as a foundation for human development, productivity, and the well-being for our nation. Madam Speaker, I will now, if you do permit, allow me to summarize in Setswana.
You're left with 4 minutes. You can try that.
May I also, Madam Speaker, indicate that the temperature situation in the House may not be, considering the honourable members that are here and considering their health, I must comment that we may want to do something with the air conditioning. Bagaetso ka bokutshwanyane ke garela re bua ka lephata la botsogo ke ne ke batla go tlhalosetse batho tege le setšhaba gore lephata la botsogo le tswelela ka go itemogela dikgwetlho tse di amanang le dikarolo di le mmalwa nka simolola la ntlha e le bothata ja bodiredi lephata la botsogo le thaelwa ke bodiredi le thaela yalo ke madi a go hira le gone go atolosa ditirelo tse e leng gore re ka tswe re na le keletso ya gore di atolosetse Batswana. Lephata la botsogo le tswelela le iphitlhela le na dikgwetlho tsa yalo gone go thabolola dipatela tsa rona le tse le setse re na le tsone le ha re sentse re itemogetse teng gore re ka thabolola yang re ka ditokagatsa yang re hela re iphitlhela le gore re na le dikgwetlho tsone tseo tsa madi re tshwanela re iphitlhela re na le bothata ja gore ko re batlang go aga teng dipatela ga re ise re kgone gore re dire jalo ka gone gore re na le bothata jone jo ja madi mme batlotlege ga se mathata hela a re a itemogetseng re le goromente wa UDC re tsere boikarabelo ja gore re ka dira yang go rarabolola mathata mme nngwe ya ditsela tse e leng gore re tla di dirisa go rarabolola mathata ke go bereka le ba e leng gore ba ikemetse ka nosi gone gore re kgone go aga dipatela re kgone go aga ditleliniki re bereke le ba ikemetseng ka nosi gone go bona gore ditsompelo di a tsena mo dipateleng ke gone go thabolola melao le ditsamaiso tsa rona gore tlogaletsa go isa ditirelo ko Batswaneng ke batla ke tshwaele gape le gore re tsweletse ka go itemogela dikgwetlho mo go iseng dipilisi le melemo ko bathong mme ga re ka ra nna hela re le goromente ile re lemoga gore go mo ke kgwetlho ya rona mo bošeng yana tautuna o na thoma seemo sa tshoganyetso se ka sone se neng sa re kgontsha gore re kgone re reke melemo ka selekanyo hela se le gore se tla kgona gore Batswana selelo se ba ntse ba na le sone se se kana sa melemo se gokotsega mme jaaka ke bua jaana melemo e ntse e goroga mo lehatsheng la Botswana seemo se ntse sa ritibala bathotegi jaaka go ntse go tsweletse ke batla go tlhalosa gape gore re le lephata la botsogo nngwe ya dintlha tse e leng gore re di ikaeletse le goromente wa UDC ke go tisa a national health insurance system. This national health insurance system kana scheme ke one e tla dirang gore Motswana mongwe le mongwe mo lehatsheng le a kgone go nna le tshiamelo ya ditamelo tsa botsogo ya ditirelo tsa botsogo go sa kgathaletsege gore o kae mo lehatsheng la Botswana go sa kgathaletsege gore seemo sa gago sa itsholo ke se se ntseng yang tumelo ya rona ke gore ga go a tshwanela go nna le Motswana ope yo e leng gore o togetse konte yo e leng gore wa sotlega kana wa sokola kana ha tshwantse gore a bone ditamelo tsa botsogo go gore jaanong o ka nna le gone gore jaana a phuthamelwe le ke lone letseno le e leng gore a na le lone e le ka ntata ya go batla go ituelela ko go ba ikemetseng ka nosi jaanong re le ba botsogo re tshwere ka thata go thomamisa gore ga gona Motswana ope yo o togelwang konte ga go ta mo ditirelong tsa botsogo re tla tswelela yalo re na le maikemisetso a go aga dipatela a go aga ditleliniki ya ka ke setse ke buile mme re tla dira yalo ka go itshwaraganya le ba ba ikemetseng ka nosi ka lekalo ke a leboga. Thank you, Madam Speaker.